You're watching Local 10, home of Local10.com. WPLG Local 10 News at 5 starts now.
Well, coming up, we take a closer look at diabetes and how it can rob some people of their sight. We have the warning signs and treatments next on Local 10 News.
Nearly 2 million cases of diabetes are diagnosed in the U.S. every year, 2 million. And it's a condition that increases the risk for heart disease, stroke, and even blindness. Tonight, Local 10's Christy Kruger takes a closer look at the actual causes and risk factors for a very common diabetic eye disease.
Carlos Infante has lived with diabetes for more than 15 years, a condition that slowly began robbing him of his sight.
Glasses weren't helping.
A condition called diabetic retinopathy was destroying his vision.
So what happens is, the blood vessels start leaking some fluid, and sometimes actually little dots of blood appear in the macula on the retina. Occasionally, new blood vessels can grow in areas they shouldn't be, and these are fragile blood vessels. They may produce scar tissue or bleed into the eye.
Carlos lost total vision in his right eye, and then his left eye began deteriorating.
Carlos came in with no balance, no depth perception, and the inability to actually walk straight. I mean, he certainly was tremendously vision impaired.
Up to 45% of Americans diagnosed with diabetes do end up having some form of diabetic retinopathy. Fortunately, there are surgical techniques now to repair all that damage. Carlos went through 2 surgeries at the Rand Eye Institute, the first one to remove a cataract that formed as a result of the diabetes.
When I saw Carlos right before his surgery, he could not even see the big E. He could only see fingers in front of his face.
I couldn't do anything. I mean, I was pretty much disabled.
2 months after the cataract surgery, Carlos went through another procedure to repair bleeding vessels in his eye.
And his prognosis right now is actually very good. It's probable that Carlos will have a lifetime of good vision if he controls his blood sugar.
It's just a big 100% difference. Maybe taking care of my diabetes would have prevented a lot of it, but it's in the past. What can I do?
He may not be able to change the past, but Carlos is committed to protecting his vision in the future. With your health news, I'm Christy Kruger, Local 10 News.
And Christy says that often there are no symptoms in the early stages of diabetic retinopathy. So it's really crucial to get an annual eye exam if you are diabetic or at risk for developing diabetes.